automatic staff assignments. Okay, so in here we can say, if Alicia is the one who is on the appointment, you know, and this rule goes for the next year or maybe 2 years, 5 years, whatever the contract is, then assign Alicia as the couples counseling clinician. Mark is her supervisor. Okay, and then if you want to automatically create the program assignment, the system can do that for you as well. So here's another way to streamline this process. You're using program assignments, and you want that program assignment to be auto-created. So we've just taken a lot of things out of that intake clinician's hand where all the clinician needs to do now is schedule that first appointment. Now the system is going to do things like fill in the event defaults. It's going to create the staff assignment. It's going to create the program assignment as well. Okay. So that just coming back to our workflow here. So we went to client admitted, and you know, the intake clinician has all kinds of follow-up tasks that we just kind of streamlined. So all they really have to do is schedule that event and make sure that appointment gets created, right? So we need to make sure the appointment gets created in order to trigger the staff assignment and the program assignment being created. Okay, so towards that end, we're going to make a task to make sure that that appointment gets scheduled. Okay, before we go into the workflow builder, I'm just going to pause. As I'm kind of pausing, making sure everybody's kind of up to date on what we did. There's no questions, nobody's raising their hands. I just want to make sure we do a quick summary of things we've covered before we go into workflow builder. Okay, so we talked about things like scheduling the appointment and having the clinicians set up their scheduling availability. We talked about streamlining the actual event creation by using this additional options event appointment defaults tool. Right above it is a shortcut to the staff assignment tool that can create the staff assignments and program assignments. Okay, if anybody has questions on these tools so far, let me know. But right now we're going to make a due date to ensure that the clinician gets that appointment created, okay? And remember, the appointment's being created by that admin config options automation.